Hello, everyone, and welcome to the Kent State University webinar for Online Masters of Public Health. Glad you were all able to join us tonight. We're just going to wait. We'll get started in a few minutes here. We're just waiting on a couple more prospective students to log in, and then we'll go ahead and get started. All right, so we're going to go ahead and get started here. Again, welcome, everyone. Thank you for joining us tonight. Tonight, we're going to be talking about the Kent University Online Masters of Public Health program and how it will benefit you. So my name is Max Schoen. I'm the admissions advisor on behalf of Kent State University. My role is to help you navigate through the process to determine if our Masters of Public Health program is going to be the right fit for you. I'll answer any questions you may have regarding the curriculum, learning outcomes, and online modality as you're deciding on the master's degree that fits your needs. If you haven't connected with me yet, please do so. My contact information is there. So I'd love to assist you in determining if this is ultimately a great fit for you and help you walk through the entire application process from start to finish. I'm also joined today by Dr. Madhav Bhatta. Very happy to have him here, and I'll let him introduce himself as well briefly here.
Thank you, Max. Again, my name is Madhav Bhatta. I am a professor of epidemiology and global health in the College of Public Health. And I've been at Kent State University over 10 years. I started in 2009 when we started the College of Public Health, and I'm one of the core faculty in the epidemiology program, and I teach epidemiology courses for graduate students at the graduate level, as well as I teach some undergraduate courses as well. And back to you, Max.
Great. Thanks, Dr. Makto. Appreciate that. All right, so our agenda for tonight, please feel free to ask any questions at any time during or after the presentation by typing in the comments section below. Out of respect of everyone's time, we will gladly answer any questions at the end of the presentation in descending order. So here's our agenda for tonight. Tonight I'll be speaking about Kent State University and why choose Kent State for your Master's in Public Health. We will go over the program features, courses, and what you'll learn throughout the curriculum. We utilize Blackboard Learn as our learning management system here. So we'll cover that as well as the support you will have access to through our student success departments. And then also we have a special topic tonight relating to recent events that Dr. Bhatta will educate us on. And finally, we'll go over tuition and funding options, the application process, and getting you set up post-application. So a little bit about Kent State University. We are a traditional state school located in Kent, Ohio, that was established in 1910. We have over 234,000 alumni worldwide. So when choosing a master's degree, you really want to consider a few things. Not only do you want to look at the prestige of the university, but also the experience the university has at delivering online master's degree level programs. So we first launched our online courses over 15 years ago, close to 20 years. So what that means to you is that we have over a decade and a half of experience of knowing what works and what doesn't work in the online environment. We offer 280 programs on our campus with over 40,000 students. 30 of the degree and certificate programs are now offered 100% online. We do not outsource our instructors for the program. So all the same instructors that teach our campus program are the same that teach our online program. So you're going to have the same rigor as you would on campus. So all of these things really factor in the credentials of your degree, learning outcomes, and career outcomes. So why Kent State for your master's in public health? Our program, first of all, is one of the most affordable programs in Ohio. We are a program in the College of Public Health are accredited by the Council on Education for Public Health, CEPH, which is the official accrediting body for public health schools and programs. So this accreditation can impact future careers and earning capacity, as there are some employers that will only hire MPH graduates from CEPH accredited programs. So we are actually the only 100% CEPH accredited MPH program in the state of Ohio. So the 5-year span is the maximum term the college could have achieved as a first-time applicant, which is what we have achieved. To earn that accreditation, we met a set of rigorous quality standards in the areas of teaching, research, and service. CEPH probably has only about 50 schools accredited in the entire country, and we're one of them. So, and then as I kind of mentioned earlier, we have been around for quite a long time. So we are the first online MPH available from an Ohio university. So, what that means is we have lots of experience of knowing what works and what doesn't in the online environment. And these professors, like I said earlier, are experts in their field. So you'll get that same rigor, but with much greater flexibility. So program features. So it's a total of 14 classes, including the practicum, for a total of 46 credits. Each course is 7 weeks in length, with one course taken each term. So you'll have each course will be 7 weeks, and then you're gonna have a week break and then 7 weeks. So you always have 1 week break as well in between each class. So there's 2 terms each semester, can be completed in 24 or 27 months. And you can take 2 courses concurrently without a break in the final 2 terms to complete it in that 24-month span. So online class time with customizable career-centered program, fully asynchronous, meaning, you don't have to be at your computer at a certain time. It's more like weekly deadlines that you have to meet. It is, catered for those who are still working full-time jobs. So very flexible as far as when you never need to log in at a certain time. It's just getting your work done when you can and just mostly meeting those weekly deadlines for your projects and assignments. And then we do have 2 specializations to choose from within this program. The first one is health policy and management, and the second one is social and behavioral sciences. Just briefly, to kind of give you a little bit of the difference here in those. The health policy management concentration, you'll be trained to analyze health policies to identify the problems and develop solutions. You'll also develop solutions to better meet the health needs of a population as a whole. In the social behavioral sciences, you'll be studying theories that actually affect health behaviors, and you'll also understand the role of social factors in public health programs. So Blackboard Learn, I believe I mentioned it a little bit earlier, is the learning management system that we use here, where you can submit assignments, access all your course materials, and see your grades. It will give you access to narrated PowerPoint presentations, video and audio recordings, live chats. So you can actually log in and see when your fellow classmates are logged in and do live chats. You can create discussion groups and several other online enhancements. And that's something that we'll teach you as well after you're accepted to the program. We'll get you acclimated to the Blackboard Learn. So we try to keep it, pretty interactive for being 100% online. So that's a little bit about that. And then here we got, like, as I mentioned, we have a little special topic tonight. And I'll hand it over to Dr. Madhav here to go over this part of the presentation.
All right, thank you, Max. And I'm pleased to be here to talk to you about what epidemiology is, and I'll sort of relate to what epidemiology is to the two concentrations that we currently have on our online program. If you took the traditional, we have 5 concentration as of right now: epidemiology, biostatistics, environmental health science, as well as the 2 that we have online, fully online right now, health policy and management, as well as social and behavioral science. But even as if you are social, behavioral, and health policy, you still have to take at least 1 class in epidemiology, as well as 1 class in biostatistics, because as I'll talk about, those are really fundamental courses that are really, provide you a foundation for understanding population-based health. And how do you, even though you may be doing policy and management, you have to understand the basic basis of a particular policy. Why would you want to institute a particular policy, and how are you going to assess whether that policy that you've instituted has an impact or not? So fundamental understanding of epidemiology and some biostatistics is going to be important. So I'm going to relate to epidemiology to the two concentration you have. And I believe Max is going to talk about the fact that we do have a clinical epidemiology coming online soon, as well as in the near future, we'll have an epidemiology online as well. So I'm planning for that. So if any of you are interested in epidemiology concentration, we may have that in the future. So just again, a little bit about myself. Again, I'm a professor of epidemiology and global health in the college, been with the college for over 10 years. And as I mentioned earlier, I have been through the development of a college as well as the programs. So I'm intimately familiar with the online program as well as the underground program. And as Max mentioned earlier, the faculty who teach in the online program are also the faculty who teach on campus. So there is no distinction between the content that is offered in the online version or the on-campus version. And just to show you, in public health, you could come from any background. My undergraduate actually is in biochemistry, and then I did my master's in epidemiology and global health from the University of Alabama at Birmingham, and then came to Kent to teach and do research. So let's go on to the next slide. So we are in the middle of a pandemic, and pandemic, all of you know, is a term that is also related to an epidemic. And that's where the term epidemiology comes from. So everybody actually knows what epidemiology is, or have a slight idea of what epidemiology is in the last 6 months. But prior to 6 months, if you had asked people on the street what epidemiology is, and people would not generally know what it is. And they may say, oh, has that something to do with the skin, because of the epidermis? Sometimes they may have heard that term. So, but epidemiology now is, everybody knows it has to do something to do with the diseases. And yes, it is a study of diseases in human population. And the whole field of epidemiology, as well as public health, started about 170 years ago, when there were cholera outbreaks that were occurring in England and Europe. And prior to that, when cholera outbreaks occur, people had different theories about how, what was the cause of cholera, and specifically the diarrhea that goes with cholera. And in 1850s, there was a physician named John Snow in England who theorized that cholera was actually related to somehow contaminated water. At that time, we didn't know, but at that time, the scientific knowledge wasn't there enough to know actually there's a pathogen that causes cholera, but John Snow surmised that it has something to do with contaminated water. Where you drink water from has something to do with whether you're gonna have cholera and die of cholera or not. And he actually started an epidemiology studies to show that people drinking water out of a certain, supplied by a certain water company had a higher risk of death compared to another company. And that was the first epidemiologic study that was conducted. That's why John Snow is known as father of cholera. That was 170 years ago. And, in 2020, now we're still dealing with infectious diseases and disease transmissions that are occurring in population, trying to figure out what the cause of a particular disease is. We know now, COVID is caused by a virus, but we're still trying to understand how is it transmitted, and what are the methods that we can apply to prevent the disease from a pandemic occurring. So let's go on to the next slide. So what is epidemiology? And I'm going to give you a formal definition so that we have an understanding of what it is and how it is applied in terms of improving public health. Obviously, epidemiology is a branch within the field of public health. So epidemiology, uses a methods to find the causes of health outcomes and disease in population. So epidemiology works to understand, what the health outcome is, and what are the causes that are contributing to that particular health outcome. And as a field of public health, as a field within a public health, we deal with population level issues rather than looking at what is the disease happening in a particular patient. So our patient in public health, we deal with community level rather than individual level. So the formal definition of epidemiology is the study of distribution of and determinants of diseases and health events in a specific population. So there are really key terms in this definition. It's about distribution, that is, in a population who are more likely to have a particular disease or health condition than others, trying to figure out who are at a higher risk. And we want to understand why people are at a higher risk compared to others. Take the example of COVID-19 right now, right? COVID-19 is a pandemic. That means it has impacted almost global population. But within a particular population, not everybody is at the same risk of getting infected with the virus that causes COVID-19 or dying of it. We're trying to understand what is the profile of somebody who's likely to be infected with COVID, more likely to get infected with COVID, and then potentially die of the disease. So that's about distribution. And we want to understand why a certain population are at high risk of getting an infection or dying of the disease. So those are what we call causes or risk factors or the determinants in a population. Obviously, we want to understand these issues, where it is happening, in which population, what is the profile of the people, and what is causing because we want to control a disease or a adverse health outcome in a population. So there's a practical application to why we need to understand the distribution and determinants of health. Next one. So So what do epidemiologists do? We determine the extent of disease in a population. So we basically, measure things. How big is a problem? What is the incidence of the disease? So every day, I look at what is the incidence of COVID-19 right now in Ohio? Is it increasing, decreasing? In the United States, other states as well as globally, we have to measure the extent of the disease, because that's the only way to figure out, whether we have a problem or not. And then the epidemiologists to try to identify the etiology or the causes, the risk factors. That, if you don't understand what the risk factors or causes are, then you can't actually do anything about a particular health problems. Obviously, epidemiologists work to identify new syndromes and diseases. Epidemiologists actually and public health professionals have been in the forefront of identifying new diseases and new syndromes. When there's a new disease and syndromes comes in a population, epidemiologists are probably the first one to identify, oh, okay, we have a particular disease or new kind of disease in this population, and based on who are being impacted, these may be the risk factor for this disease. Is this, epidemiologists are in the forefront of COVID-19, as well as any other diseases that you can think about. Epidemiologists, we're also called the disease, that's why we're called disease detectives as well. And epidemiologists, one of the other things epidemiologists do is evaluate existing therapies or newly developed therapies or preventive programs. For instance, how do you know if hydrochloroquine actually works towards treating COVID-19 or not? You have to do epidemiologic study. Or whether the use of facial coverings, mask, actually reduces transmission of COVID-19 or not. How do you know that? Well, we do epidemiologic study to figure out whether a particular intervention or therapy works or not. If and when we come with a vaccine for COVID-19, that has to be tested, whether the vaccine that will come actually does work. Does it work in a population or not? How do you do that? You actually do epidemiologic study where you give a group of people a vaccine and other people, what you call a placebo, and see what is the rate of disease in these two groups. Compare those, measure and compare. That's some of the things epidemiologists do. And next one, please. So obviously, having said that, so epidemiology is really essential ingredient for public health and for the field of public health and improving population health. For three things, when you're trying to deal with a health problem in a population or improve a health of a population, or trying to take care of a particular health problem in a population, there are 5 things that are essential. First and foremost, you have to know the problem exists in a population. If you don't measure COVID-19 in a population, you're not going to know whether you actually have COVID-19 or not. If you don't test, you're not going to find out. You can say, well, we don't want to test, and then problem may not be there, but that's not the way to go. You have to measure things. You have to be aware a problem exists. How do you know a problem exists in a community or population? You have to do the measurements. So that's what epidemiologists do. We actually measure, disease and health conditions, health events in a population. And you have to understand, what is causing this problem to occur in a population. Understanding the cause. That's what epidemiologists do, right? Trying to figure out the cause. And we have to have intervention capability to control that disease or health problem in a population. And we have to know whether the intervention that you came actually is effective or not. So that's what epidemiologists also do, of trying to measure the effectiveness of a population. So And the couple of other things that you need for, to solve a problem in a community is you have to believe that's important enough to work on it and have the political will to do it. So these are the 5 ingredients, important ingredients for successful public health programs. Out of that, 3 of them are within the purview of epidemiology. So it is a quantitative branch within the field of public health, and other being biostatistics goes in hand. We use some of the biostatistical tools in epidemiology. And as I mentioned earlier, other components of public health disciplines within the field of public health include environmental health sciences, social and behavioral sciences, and health policy and management, which are the 2 concentration that we offer online. But all of these 5 disciplines are important and they're interrelated. Even if you're a health policy person, you institute a public health policy, say, okay, in a population, you have to know whether it works or not. Facial mask, should that be a facial covering? Should that be a public health policy or not? And you have to measure the effectiveness of that intervention. You will need to understand epidemiology. Social and behavioral science, why do people are reluctant to wear facial mask covering or not? As a social and behavioral person, you'll try to understand that reluctance and try to figure out a way to reduce the reluctance. Next, please. So if you are interested in epidemiology, to be an epidemiologist or in a public health professional, who can be, Well, anybody who has an interest in working with a population, trying to solve health problems in a population would be a good candidate for Masters of Public Health program. And if you have a little bit of a more quantitative inclination, critical thinking skills, then want to work with the interdisciplinary team, then you are the right candidate to be an MPH program or an epidemiology program specifically. Because you're going to be applying, you're going to be learning the skills, quantitative skills, critical thinking skills, your oral communication and writing communication skills, and working in groups, because you can't just do things on your own. You have to be part of a team. And that's what you'll learn during your MPH program, and you'll take these skills and go out and apply in the real world, whether you're dealing with a pandemic or you're dealing with an existing health problem. Next one, please.
Oops, sorry.
That's all right.
I gotta go back here.
All right, so having said that, with those skills, once you have those, where can you work with epidemiology and just a public health skills? You might think, well, with an master's in public health degree, you might be thinking, oh, do I only have to work in public sector because the MPH has a word public? No, not necessarily. You can work with, government at different levels, locals, state, national level, CDC, Ohio Department of Health, or local public health department. That's one area that you can work. You can work in the private sector, the hospital, health insurance companies, pharmaceutical companies, non-profit organizations, including think tanks. You can work for advocacy group, community organization. You could work for academic institutions who are doing research or teaching. And I mentioned governmental agencies, and there are international organizations like the WHO and non-governmental organizations who are working in the field of public health globally. So in fact, my statistic may be a little old, but if I remember correctly, annually the associations of schools and programs of public health actually does a survey of the alumni in terms of where they are working. And a few years back, only about 10 to 15% of the people with an MPH degree actually go and work with the government, at various levels, state, local, and federal level. 85% go on to do other things, work in private sectors, and international organizations, and so on and so forth. So, you have a wide variety of career options that you can go into after getting an MPH in health policy and management, social behavioral science, or epidemiology. Right, excellent.
All right, thank you, Dr. Madhav. Very interesting, appreciate that. After you're accepted in the program, I just want to talk about the student success support that you have here. You will be assigned a student services coordinator who supports you throughout your educational journey here. You will receive, once accepted, and if you accept the offer, you'll be receiving a welcome call from one of our student success coordinators here. They will walk you through orientation, registration for courses, and how to navigate Blackboard Learn system that I talked about earlier. And then throughout the entire program, you always have support at your fingertips with our student success department. In addition, those of you that live geographically close to Kent State, you actually have full access to all campus resources being an online student. So for those of you that live near campus, definitely keep that in mind as well. So tuition and funding options. So per credit hour, it's $6.55 for Ohio residents, and it's $6.65 for non-Ohio residents. And it's a total, I mentioned earlier, it's a total of 46 credits for the entire program. For those of you who have additional questions, obviously, everyone's situation is different. We do have a one-stop for student services where you could call for financial aid. That phone number is 330-672-6000. Feel free to reach out to me as well if you want me to give you that information. I'll show you my information again at the end of the presentation, so feel free to reach out to me. So a little bit more about financial aid. We do have a dedicated financial aid advisor that specifically works with our online students who are paying out of pocket to create more of a budget-friendly payment schedule. A lot of students will apply using the FAFSA application, which is your free application for federal student aid. We do also have scholarships that are available for active and accepted students. And you also may be eligible for tuition assistance or benefits through your employer, through your spouse, or through the military. So a little bit about the online MPH scholarships. Admitted students into the online program are eligible to apply for the scholarship. The award amounts can range from $500 to $2,000. Scholarship applications are considered on a rolling basis and will be awarded based on the availability of funds. And for full details and link to scholarship application, please connect directly with me. I'll be happy to get you all that information. Just shoot me an email and I'll get you all that pertinent information for you. So the admissions requirements, obviously it's just an online application that you will complete. There is an application fee of $45. We will need official academic transcripts from all universities or institutions attended. So You know, if you did, you know, switch to, you know, go to a community college and then switch back to your school or something like that, we will need the transcripts from all those institutions. We look for a completed bachelor's degree from an accredited university with a cumulative GPA of 3.0 or higher. But I would definitely still encourage you to apply if you do not have that 3.0 GPA. We do definitely take a very holistic approach, and we'll look at, you know, other aspects of your application rather than just your GPA. So I always encourage the students to apply regardless, but that is what they look for. We'll need a resume, a goal statement. One of the things that can really set you apart as you apply is this goal statement. So what we'll be looking for is a snapshot of you as an applicant. So this includes interests, desire, and motivation to get into the program. Why are you looking at Kent State and MPH? Include any career objectives. And this will be, so any like relevant work experience is also, you know, great to put in there. And this will be about 2 pages double spaced. 3 letters of recommendation, academic or professional. And then for those international students, we will need the official TOEFL scores if applicable. We do need those as well. So here are our deadlines for fall 2020. Our priority deadline is July 6th. And our application deadline is going to be August 10th. So you need to make sure you have all your supporting documents in no later than August 10th. And classes will start on August 31st. For those of you who I have not spoken to, I do strongly encourage you to give me a call. I'm happy to send you over an application checklist to kind of just give you a breakdown and a plan to get your application done and you know, get you started and help you throughout the entire process. So I'd like to thank Professor Bhatta again for spending time with us this evening. Very interesting insight, very informative, and definitely something that, you know, it really pertains to what's going on right now, and something that everyone is affected by in a certain way. So we appreciate that. Once again, I'm Max Schoen, your admissions advisor. Here's my email address again. You can also contact me via phone at 330-474-3285. My extension here my direct extension is 300. We appreciate you guys all for coming in tonight and spending time with us. Please stay safe, and hopefully we see all your applications rolling in soon, and hope to hear from you guys. So everyone take care.
Thank you, everybody. Bye.